Hi, I'm Dr. Kivett. I'm a board-certified plastic surgeon and dermatologist in Santa Rosa, California. I'd like to speak today with you about common growths in the skin, the things that concern people when they're not quite sure what they're looking at, things for which they may need reassurance, biopsy, treatment, who knows? We see people all day long with a variety of those things, since the majority of my practice involves looking at lesions, many of which are cancers, treating them, examining wounds that come from either acute changes, such as an accident or a fall, chronic wounds, which come from traumatic problems or work, hand deformities, hand injuries, and birth defects. The most common growths, for the most part, tend to be benign, but there are a lot of cancers as well. So the first thing we can mention is something called angioma, which is simply just a growth of blood vessel cells, which are very tiny. And they're characterized as a small, small dot on the skin, which is bright red and which concern people. Some of them are purple. There's no need to treat them. If they need to be treated for cosmetic reasons, that can take place, but everybody seems to get them. They're also seen in pregnancy because the pregnant woman has developed a set of hormones called angiogenic hormones, which stimulate the production of much larger blood vessel cells in the placenta, which feeds the embryo and the fetus. And so these are very common. Don't mean anything, don't need treatment. The second common growth is something called cyst, which is a derivative of the lining over a hair follicle. And that tissue, instead of molting outward like our skin tends to do, will actually molt inward. And then those cysts will have the skin go ahead and die internally. And as long as it's not leaking out of the sphere, which envelops the cyst, causes the cyst to exist, then there's no problem. However, if they have some leakage, the patient will then experience some pressure and some redness, but it's not infection, it's just inflammation from the acidic material inside the cyst. And so that can be relatively easily removed with local anesthesia, but the entire wall must come out because simply cutting into it and getting out the material inside is just not very valuable. Another common growth is dermatofibroma, which is like a little pea or smaller sized scar, mostly on the lower legs, sometimes on the upper arms, that they believe comes about from a blood vessel that collapses and forms scar tissue. I've had one on my leg for well over 25 years, and it's of no consequence and doesn't grow. A lipoma is a fatty tumor, and the fatty tumor will develop from just the basic fat cells in the skin. And tumor just means an area of collection of cells. They don't mean necessarily cancerous cells. Tumor is just a word used to describe a mass. Milia is a deeper blocked pore. It's a type of cyst that forms on the eyelids and the cheeks as small white bumps, and a lot of oil-bearing products applied to the skin result in the growth of milia. Also, moles can appear anywhere on the body, and moles come from the multiplicity of cells coming off of the spinal cord when the embryo is still in the womb, and those cells normally line up and are fused into cables, which we then call nerves. But there's a lot of trash left over in that process, and the trash is actually moles, and those moles travel to various parts of the body and are there for the lifetime of the person. And as long as moles are normal appearing, they don't require a biopsy. But if they become symptomatic, such as itching or bumped by a run through the scalp with a comb, that's reason enough to shave them off superficially. Other things that people get are things called neurofibromas, which are little masses in the skin that look like little zits that are comprised of nerve tissue and scar tissue and are of no importance. Sebaceous hyperplasia is sebaceous glands, oil glands, which overgrow, and so they look like yellow-orange dots on the face, around the nose, and the upper cheek area is a very common problem of no importance. Sebaceous cells are rarely problematic. Seborrheic keratosis is what I call a barnacle, and so if you have a dark brown or a lighter color area that looks like the bottom of a dry lake bed in an area about the size of a pencil eraser, those are called seborrheic keratoses, and they're not usually a problem whatsoever. They're easily treated for cosmetic reasons for the most part. There are common things called skin tags, which look like little nipples sticking off the skin of varying sizes, and they tend to be in areas that are rubbed by clothing or by another part of the person, such as in an armpit or around the back of the neck or between the legs. And so those are easily destroyed should they be symptomatic. Removal of those common growths are sometimes covered by insurance, but other methods of destruction can take place as well, such as just being made cold by a cold spray, or by a little tiny electric pencil, or by a snipping technique. Very common problems, not much to be concerned about, but best to have somebody who knows what they're looking at, look at them, and then treat them in a manner that is helpful to make sure they're not cancer, if that needed, or doesn't change the function of the area, or have a major impact on cosmetic appearance of the skin. So if this was helpful to you, please tell a friend to watch it as well. You're certainly welcome to leave a comment or question below. Give us a thumbs up. And if you'd like to subscribe to our channel, this will help us continue to provide better educational information for your good health. Thank you for listening. Take care.